Hello, friends. Welcome to yet another episode of NEET PG Concepts. I am your host, Dr. Shadab Jafri. Now, today we'll deal with some very important neurology MCQs. I hope you will enjoy this session. Now, of late we have been dealing with the neurology, and it seems that you are not giving me that encouraging response. And so now we'll go again in a retrograde manner, and we'll deal some MCQs so that interest is back in you. Now, friends, we'll move on to the our neurology, some common MCQs. Now, before moving to the MCQs, now you may be knowing that the 2 or 3 years back the question paper of NEET PG was of 300 questions. When the 300 questions were there, then the questions were smaller. Now it has been changed to 200 questions, and in 200 questions, often there are multiple lines given, and you have to read those lines carefully, and you have to catch those keywords. And sometimes the last portion of the question has very important um, keys, like the some figure is given and you can change the diagnosis on that basis and you can answer the question. So coming back to our first MCQ, now you see we have dealt about this ischemic stroke pathologies in our previous videos, and now you must be having some base. So now we move on to our first question. Now a 65-year-old patient presented with acute hyperesis and CT was done after 3 hours. Image given below is image is given below. BP was 190 by 100. He was started on medication. The BP was 180 by 90. He had myocardial infarction 1 year back for which he is taking medication. What is the definitive management of this patient? Now the four choices are given. Now you see this figure, the CT is given, and you can see here what you can see here. There is a demarcation between the gray matter and the white matter is lost in this CT, and you can see that there is a clear cut edema in this case. Now you move on to the question. Now the BP was initially 190 by 100, and now after treatment the BP is 180 by 90. This is the first clue. He had myocardial infarction 1 year back. This is the second clue. So now what is the answer according to this clue? These words given. Now you see that they are in an ischemic stroke, the definitive management. These words are also very important. Definitive management, the first line of treatment. So definitive management, what is it? Definitive management will be the main part of the treatment which the patient should receive that the his he is treated. Now we have two options. Either we'll go for thrombolysis or we'll go for endovascular thrombectomy. Now you must have seen a chart in the Harrison which is given, which are the contraindications of thrombolysis. So you must, before going to thrombolysis, you must see whether there is a contraindication to thrombolysis in this question. Now MI 1 year back is not a contraindication because MI recent MI is a contraindication. Now BP is very important because BP 185 by 110. If it is above 185 by 110, even on treatment, then only you can say that this is a contraindication. But here the BP comes down to 185 by 110 to 180 by 90. So now this is not a contraindication to thrombolysis. Now you have to see the CT image. Now if you carefully see the CT image, now in one of the contraindications it is written that if the brain edema, if the brain parenchymal edema is greater than 1/3 of the middle cerebral artery territory, then it is a contraindication. So here you can see clearly that it is greater than 1/3 of the middle cerebral artery territory. So now in this case, the choice is between two. Now you will go for endovascular thrombectomy. Now you must read those contraindications and indications of thrombolysis for an ischemic stroke, which are very important, and the keywords will be hidden in the question and they can be asked. Now, what are other two choices? Now, dual antiplatelet therapy, IV enoxaparin, they are part of the management. But the definitive management, what is the definitive management? Definitive management is definitely between these two choices, and endovascular thrombectomy is the clear-cut answer in this case. Now, you see that some topics are very favorite for of the examiners to ask, and they repeatedly ask those topics. So, it is for an entrance examination point of view, it is not you read you keep on reading Harrison. You have to read those topics which are often asked very frequently, and you have to master those topics. Now, look at this second question. Now, a 30-year-old patient with a 12 weeks pregnancy presents with severe headache and altered sensorium. What is the investigation of choice in this patient? Now, Here the keyword is pregnancy and severe headache and altered sensorium. Now, what can you think in this patient? What the headache can be migraine simply, but it is not labeled medication. Altered sensorium can be present, but you can do MRI or CT in a case of migraine. But here specifically it is given pregnancy. So this word has a clincher. This has some meaning. Now, what is this? Now they clear cut it. There are four choices are given. Now, what will you do out of these choices? Now you see that in ischemic stroke, there is a cardiometabolic causes are there, which are most common, but there are some lesser uh, causes which are important and which lead to hypercoagulable state. And out of that, pregnancy is one of them, and that's why it is given this question. Each and every word which is given question has some meaning. So now you see that in this out of the four choices, MRI with MR venography will be the most common is the best answer because we are suspecting the cortical venous thrombosis in this patient. Now, if it would have been given pregnancy is given, it would have been given postpartum period or patient with OCPUs or sickle cell anemia or SLE or Lehmann-Sachs endocarditis. So all these are the hypercoagulable states, and the answer will be MRI with MR venography. And cortical venous thrombosis is a very important topic, and it has been asked often uh, in the examinations, and you must be very thorough with this. Now we move on to our third question of neurology. You can consider it to be of endocrinology also. Now this is also a very favorite topic of the examiners, which they ask repeatedly every time. A lady in the postpartum period presents with lactation failure and extreme fatigue. BP was 90/70. She had history of postpartum hemorrhage. Now MRI head is given below. Now what is the diagnosis? So you see, or how will you manage the patient? Now you see what first we'll go and see what is the this MRI image is showing. Now you see that the patient is having lactation failure and extreme fatigue and BP is also low. And MRI is given below and the MRI is MRI is clearly showing that this is a case of Sheehan syndrome or postpartum pituitary necrosis because the pituitary fossa is empty. And normally this pituitary fossa is not like that. I'll show you the normal figure of the normal MRI of the pituitary fossa, how it looks like. And this is a you can see the empty cella. So it's a case of postpartum pituitary necrosis or Sheehan syndrome. Now, how will you manage this patient? We'll see further. Now, first you see this normal skull MRI, normal head MRI. And what you can see here? You can see that the cella is not empty. Here you can see that there is a hyperdense area, hyperdense to normal dense area, and in the previous figure it was a hypodense area. There the cella was empty. So now you see how will you manage such patient? Now first choice is hydrocortisone followed by thyroxine, growth hormone, thyroxine followed by growth hormone or estrogen. Now you can see that the BP is low in this patient, and in such patient you have to give hydrocortisone. That is very important. Actually, the definitive management is the hormone replacement therapy, and that has to be given lifelong. But if the choices are this, you have to choose the best answer, and first you have to give the hydrocortisone, and then followed by that the thyroxine has to be given, and after that then each and every hormone which is deficient, which you first you will do the hormone profile, and which hormone is deficient, you will go for that. So here the best answer is hydrocortisone followed by thyroxine. Now coming back to a fourth and the last question of this session. Now this is also a very frequently asked topic and very important topic which we'll see in every entrance examination repeatedly. They are asking this, and now see, a 70-year-old patient presented with acute onset diplopia, ipsilateral facial numbness, hoarseness, dysarthria, dysphagia, and ipsilateral Horner syndrome, and loss of taste, and contralateral loss of pain and thermal sense over half the body. Now, which artery is involved? Pica, posterior inferior cerebral artery, superior cerebral artery, cerebellar artery, vertebral artery, or anterior inferior cerebellar artery. Now, what is the choice? Now, you can see in this figure, you can enlarge your video and you can see this figure. This is the cross section at the level of the medulla, cross section of the at the level of the medulla, and you can see what structures are there and the lateral side of medulla, and what are the at the medial side of medulla. Now, from medial to lateral, if you move, now what is there? In the medial, there is a medial lemniscus. So, what the medial lemniscus will what is it carrying? It is carrying the proprioception and the pressure fibers. So, and on the lateral side, you have the pain and temperature fibers. That is the lateral spinal thalamic tract, and all the hypoglossal nerve nucleus, the dorsal motor nucleus of the tenth nerve, the nucleus of tractus solitarius. So these are the nucleus which are present. According to that, the pathology is given. Now you know that the pain and temperature fibers from the lower side of the body, they cross to the opposite side. So that's why the contralateral loss of pain and thermal sense over the half of the body is given, and others they are ipsilateral. Now, most commonly asked, and this is the lateral medullary syndrome of Wallenberg, and this has been asked often in the examinations, and the answer is between either posterior inferior cerebellar artery and the vertebral artery. Now, if any one of them is given, that will be the answer. But here, both of them are given. Now, these two arteries are most commonly involved, and if the both the choices are given, then vertebral artery will be the best answer, because here the complete medullary syndrome is given, and vertebral artery is the best answer, and posterior inferior cerebellar artery will be the answer if vertebral artery is not given, and posterior inferior cerebellar artery often give rise to partial syndrome. Partial syndrome means all of the features will not be present, only some of the features will be present. So here the answer is superior cerebellar artery. Here the answer is vertebral artery, and the diagnosis is lateral medullary syndrome of Wallenberg. Now, what is medial medullary syndrome? In the medial medullary syndrome, you see that the medial lemniscus will be involved, and so not much of these pathologies will be given, and only there will be loss of touch and proprioception will be lost. So I hope you understand this, and this will finish the diagnosis. Now, please do like and subscribe our channels. In the past few days, I have seen that not much of the people are taking interest, but believe me that this is the way in which you should study, and in the less amount of time, you can give your maximum